We're going to move on to the next section now, which is the crow's feet. Patients will commonly present describing lines around their eyes when they give a big cheesy smile. Now, the muscle involved here is the orbicularis oculi. There's many components of this muscle, but for our treatment purposes, we're going to focus just on the lateral component, the most outer edge of this muscle, because that's what's most involved in creating those fine lines. The best way I like to examine for this muscle is get the patient to do a really big cheesy smile, and that will show up all the smaller, finer lines in the area. My technique for treating this area is we're going to palpate the orbital rim to begin with. So this is just that bony edge around the eye. You're going to find the midpoint of the eye, which is called the lateral canthus. You're going to go 1 centimeter back at least from that area. You're going to put a little dot there. That's our border for treatment. When the patient gives us a big smile, we'll be able to see exactly where the lines are extending to. We mark out those areas because that's the most active area of the muscle. When treating this area, we want to keep our injections superficial. We do not want to go deep in this area, as there's a lot of muscles that attach to the cheekbone that impact our smile, and we do not want to impact our patient's lovely smile. The main complication that I worry about when treating the crow's feet region is if patients have poor lymphatic flow. So you can determine if a patient has this issue by asking them if they wake up in the morning, if they get really puffy eyes, or if they get puffy eyes throughout the day, and they find like they're always rubbing their eyes trying to move fluid around. This might be an indication that the lymphatic system is struggling in that area and that the muscle is very important to actually move that fluid. If we treat this region and someone has poor lymphatic flow, it can actually build up a lot of fluid around their eye and make them look even more puffy. So it's always best to screen for this to begin with so that we don't have our patients coming back with those complications. Okay, so we're going to begin the crow's feet section now. We're just going to clean around the eyes. And around the eyes. Excellent. I'm going to come onto the other side for me to demonstrate this one. So the muscle we're treating, as we spoke about previously, is orbicularis oculi. This muscle extends quite far out. It's a big circle muscle. So it's going all the way around the eye. What we need to do is get Emmy to do a big smile for us. And you can see as that muscle contracts, these small lines appear. What I'd like you to do is find that last line and just mark it. So if Emmy smiles again, you can see there's the last line and relaxing. Same goes for this line as well, the top. And what we've identified here is a nice little treatment zone where the most activity is happening for that muscle. It's very important not to treat far down or chase the lines. Some patients might have lines that extend all the way down into their cheeks. Do not go into this area because you may inadvertently hit some muscles that are affecting the smile. We want to keep our treatments very local. We need to identify the lateral canthus, which is right here. That's just the joint between the two eyelids. If we measure 1 centimeter back, that forms our treatment area in here. We're going to palpate the orbital rim now. One of the injections is going to be at the lateral canthal point where the two eyelids meet. We're going to go back to that point and just a little bit further, about 1.5 centimeters total from that point. That's going to be our first injection point. And then within that treatable zone, we're going to place 2 others. I was going to put that a bit darker so you can see it. Okay. If I get Emmy to smile again for me, we can see that whole muscle in that area has been affected and relaxing. Great. So we've identified our 3 points. I'm going to get Emmy to do a big smile again just to confirm. There's the first point, second point, third point, and relaxing. Now, if you're not using a distraction device, you can use your finger to pull the skin nice and taut and then inject. If you're using a distraction device, place the device close to where you're going to inject, pull it taut, and you can use the other hand to assist as well, and then inject. I'm going to show you with the distraction device first. First one, 1, 2, 3. Injecting and releasing. You can see that when I'm injecting, we're not going very deep. We're in a very superficial plane. just to avoid getting any of the muscles that might be situated underneath. Next one, I'm going to pull taut. 1, 2, 3. Injecting and release. Last one at the corner of the brow. Pulling taut, injecting and release. This is a very vascular area. There's a lot of little veins that run through here. That's why it's always important to have your gauze in your non-dominant hand so that you can apply pressure if there is any bleeding. In this case, there isn't.